Jonathan Watts, welcome to Alpala Rahul Institute.
Thank you.
And to this Panshu channel. Thank you for joining with us. If Jonathan, you yourself can introduce about you, and that will be easy. Please.
Sometimes it's a little strange and complicated, so better for me to introduce myself.
Yes.
My name's Jonathan Watts. I was born in the United States, but I left in 1989. I graduated university and came to Asia. I had studied Asian study. I studied religious studies and also political issues, and was interested in those things, but had no real plan. I ended up teaching English in Indonesia, but then I ended up in Thailand, and I discovered engaged Buddhism there. And since 1990, I've been part of the international network of engaged Buddhists. At a certain point, I moved to Japan. I've been in Japan for over 30 years now. I presently work at the International Buddhist Exchange Center in Yokohama for the Kodosan Buddhist Fellowship. I've been there for, next year will be 20 years. And I've been researching and also promoting and being active in engaged Buddhism in Japan for the last 20 years. I've been doing a lot of work, end-of-life care. Actually, we've been covering a lot of different issues, end-of-life care, suicide prevention. After the Great Tsunami in 2011, we worked on disaster trauma and started a Buddhist chaplaincy training program. Of course, there was the Fukushima nuclear incident. So I started working in anti-nuclear issues and Buddhist-based holistic development. And just this year, at the beginning of this year, especially coming out of the chaplaincy, end-of-life care, and the suicide prevention work, we established an Institute for Buddhist Chaplaincy and Counselling, IBCC, which is under the auspices of INEB, International Network of Engaged Buddhists, based in Bangkok. And it focuses primarily in bringing programs in Buddhist counseling, Buddhist chaplaincy, to locations in Southeast Asia and South Asia, where these kinds of programs are of great interest, but there are very few such programs. Most of the programs are located in the West and in North Asia, so we want to make them available for more people here.
Oh, great, great.
So that's one of the reasons I'm here in Sri Lanka now.
Perhaps the viewers will be interested to know a little more about the INEB. Can you explain
yes.
it?
INEB was founded in 1989 in Thailand. It was founded by a small group of engaged Buddhists, but our leading founder is a Thai engaged Buddhist named Sulak Shivaraksa. And he's sort of part of this same generation as Dr. Aryaratne here of Sarvodia, Thich Nhat Hanh in Vietnam. Those are sort of the three sort of very well-known names in this region of that generation. Right. And it's an ecumenical network made of Buddhists from all different backgrounds, north, south, east, west. Has a number of non-Buddhists because we work on social issues. So we work with people from other religious groups, people who aren't religious. We find that the social problem, kind of the dukkha in society, is a great uniting force that can help people overcome all sorts of divides. When you're working on saving the planet and environmental issues, suddenly you don't care if someone's from a different religion. So our network has been building and thriving. Especially over the last 15 years, we've become quite dynamic, and we have members, we have offices all over Asia, in some parts of Europe and the United States as well, working on just a huge, incredible array of social issues, trying to bring. I think the unique thing about INEB is there are Buddhists who do social work, but sometimes their social work is sort of no different than anyone else doing social work. You can raise money and give blankets to poor people. And if a Buddhist does that or Christian does it, it doesn't mean anything. But For us, engaged Buddhism means taking the principles of Buddhism and the practices of Buddhism and sort of bringing them out and updating them for modern society and seeing if there's something particular and unique we can offer through the wisdom of the Buddha and the Buddhist teachings.
Yeah, I think those who are interested, they can go to the website and see.
Yes, INEB, INEBnetwork.org, something like that.
Okay.
Yes.
INEB.
INEB, International Network of Engaged Buddhists. Yeah.
Right. Yeah. Yes. Now let's go into our today's discussion. Sure. You have been developing and working on facing death and programs for suicide prevention.
Yes. Yes.
It will be very useful for our community and to all those who are watching our programs to know more about this. And yes, please.
Well, so the background of it is I've been living in Japan, and in the mid 2000s, around 2005, 2006, I was working in two different research institutes for two different Buddhist organizations, sort of to make my financial ends meet. So I was working with two different groups, totally fine. They're friendly groups. For one group, it was called the Jodo Shu Research Institute. Jodo Shu is a Pure Land Buddhist denomination. It's an ancient denomination about 800 years ago, created in Japan. And the director that I worked under, Reverend Yoshiharu Tomatsu, became very interested in end-of-life care and Buddhist end-of-life care. And Buddhism has a great ancient tradition of dealing with death, facing death mindfully. So many important practices from the time of the Buddha, stretching all the way into Vajrayana about how to handle death. But in terms of modern end-of-life care, I think the Christian were the first really to develop modern hospices. Cicely Saunders in the United Kingdom is considered one of the founders of the modern hospice movement. And there's been an interest in developing Buddhist-based hospice care in Asia. And with that, bringing Buddhist teachings into the end-of-life care process, because there are certain fundamental differences in how a Buddhist sees the end of life and how a Christian might see the end of life. So we wanted to do a research project, and we did a global research project. We traveled quite a bit. We went to the US, we went to Europe, we went to other parts of Asia to look at hospice work that we could find being done by Buddhists. So it was quite fascinating work. And we learned a lot, not only about end-of-life care, but we learned about something called chaplaincy. And I think, as I always say, we're talking about Buddhism in English, which is sort of doesn't work so well because English is a Buddhist poor language, and we're always having to rework the language. But when you say chaplain, a lot of people might think that's a Christian priest.
Yes.
But nowadays, a chaplain can refer to a religious professional from any religious background who is professionally trained to work in the public sector to deal with people who are having suffering around the meaning of life, their existence, existential questions. So I think the WHO, the World Health Organization, talks about the four kinds of suffering, illness, and also the four kinds of health. And it's physical, social, psychological, spiritual. So they make a distinction between psychological and spiritual. If you're considered to have psychological issues, you may be referred to a psychiatrist or a psychotherapist. But if you're considered to have problems with the meaning of life, what is the meaning of life, you may be referred to a chaplain. So the chaplaincy movement especially developed very strongly in the United States over the last 100 years. And it began as in a very Christian way, but has slowly diversified. And America is a very diverse place. So one of the principles of chaplaincy is that a chaplain who comes in to maybe a hospital or a prison is not there to teach their religion to people.
Right.
Actually, the opposite, to listen
Yes.
to them deeply and to help them find their own answers. So the training can be quite a challenge because the first step in chaplaincy is you have to train in your religious tradition. So you become a monk or a priest or an imam. But then after that, you have to go do an internship and in a hospital or a place like that. And if you go in and you start trying to convert people or just talk to them about the wonders of your religion, you will fail and you will not get any certification. You have to, for so many religious people, you have to flip from being a preacher to a listener and a deep listener.
Yeah.
So this is where chaplaincy has become something new and different in the modern world. And Buddhist chaplaincy is also redefining chaplaincy because the one thing Buddhism brings to this process is meditation and mindfulness. And the ability or the skill to, as they say, drop from the head. Many religious people learn a lot of teachings and they speak out of their head and they speak from the book.
Yeah.
But then they cultivate themselves and it enters their heart and then they can speak freely. They don't need to use that technical language. But they're still too involved in the process of saving people. Even if it doesn't mean converting them, they still want to stop their suffering.
Yeah.
Save them from their suffering. I can save you.
Yes. Yeah. Yeah.
Then there's the next stop. And in Buddhism, we talk about getting into the gut. Because when you have a deep meditation practice, your breath comes down deep into the gut, what the Japanese call the hara. And being in the gut allows you to be present in an open way with the suffering of another and create a kind of an open, safe, regulated space for that person to then explore their own life, their own issues, and their own problems. And you're sort of kind of a companion. And this is the heart of chaplaincy. And so Buddhism can be a great aid because it gives that deeper training to help you get into your gut. So in America, there are actually chaplains from other religions now studying meditation to ground themselves more. And they don't become Buddhists, they just become better Christians or better Muslims or better at their own faith because they're able to be more present. So this was another huge thing we looked at and studied when we were studying end-of-life care. And so, we did a book about this called Buddhist Care for the Dying and Bereaved, Wisdom Books, 2012. Okay. And that's a whole survey. It's a little out of date now, but it's still a good survey on Buddhist hospice work from all over the world. But it was funny because I told you that was at one research institute. Then at the other research institute, I started working on the suicide issue.
Oh, right. Okay.
Which had become a pandemic in Japan. Over 30,000 people a year for 13 straight years. So almost 500,000 Japanese people killed themselves in 15 years. And people talk about all the wars that are happening and all the people dying in wars. And this is this silent war that's been going on in Japan. And now Korea is worse than Japan. But it was interesting because in looking at the priests, the Buddhist priests who were doing this suicide prevention work, they were doing the opposite of what the priests were doing in end-of-life care. In end-of-life care, you're trying to guide the person gently into the dying process.
Yes.
These priests were trying to help people come back from the edge of death. So it was like almost the opposite.
Yes.
But it was the same skill. Same skill, the same exact skill of chaplaincy. when you come in with someone like that, that's very disturbed psychologically, emotionally, you can't talk to them about Buddha said, Buddha said, Buddha said. You create this open space. And you kind of, what we say, you hold their suffering. You hold the suffering. And this goes into Buddhist psychology. When you meditate yourself, we're learned to practice mindfulness at the point of contact. And so what usually happens is we don't have the mindfulness and we have contact, some experience, and then immediately there's some kind of dysregulated feeling, and then the craving and the attachment, and then we're into our suffering. So the meditation brings us, and we kind of hold the space. We don't react. And then from this space of not reacting, our Buddhist teachings, our wisdom, the sila, the ethics come in. So a chaplain in suicide prevention, or really anything, will kind of create almost a meditative space for someone to then just be present with their suffering and find someone who will listen to them and then explore together what's going on and what they're experiencing and maybe how there's something else they could find besides wanting to die.
Imagine that we are working with someone who is maybe cancer or some in a particular situation, and we are to help them, right? And they, I think, not only the person, but their family members, close people, and how you are working with.
Yes, well, chaplaincy is very interesting because it involves, professional chaplaincy involves multiple levels. There's, of course, dealing with the patient. There's dealing with the family. And then I've interviewed chaplains in the United States. They say 50% of their work is working with the other caregivers, the doctors and the nurses, who suffer terrible rates of burnout and higher rates of suicide than the normal population. Because you think, if you and I have a bad day at work, our YouTube video is boring and people turn it off. That's our bad day. But a bad day at work for a doctor or nurse, someone dies. So the chaplains have to work on all these levels. And then chaplains will even work on to another level, what we call systems level, which is kind of working on social ethics. So a chaplain may be working at a hospital, and doctors sometimes have high levels of pride and ego. And so you can get into certain places where the doctors have a little bit too much arrogance, and they may be, one of them may be making a lot of sexual advances at the nurses. And the care that's being given to the patients is suffering because of the problems among the medical team, because you've got one person who's, engaging not power harassment or sexual harassment. So the chaplain sees this. A nurse has a difficult time bringing this issue out. There's patriarchy, there's power. If she says anything, she might just get fired. The chaplain comes in and may have to go to a higher place in the hospital and go, we need to have an ethics committee meeting because this hospital has ethics issues. So we call that systems care.
Right.
So it's quite a job for a chaplain. They have to take on multiple levels. That's and they have to working with family members is a big issue, not only in end-of-life care, but also in suicide prevention, because of the many people who do commit suicide, and then the families who are grieving afterwards. And they often grieve in secrecy. They're ashamed of the suicide in their family. They don't make it known. So what we call grief care has become a very important aspect of this chaplaincy work. End-of-life care, suicide prevention, disaster trauma. You had a huge tsunami here. We had a huge tsunami in Japan. Many people die very suddenly. Creates incredible levels of PTSD, trauma, not just among the family members who lost people, the disaster workers, the military that had to go in and clean up all the bodies. They're traumatized by these experiences. So there's a huge need for religious persons who are well trained to hold this space for people to work out their grief, work out their trauma.
And if you go into a deeper level of this facing death, and if we are working with someone, I'm sure it is very, you have to work hard. I mean, in working with one particular patient itself is a difficult thing, right? So working with many people, the person who is going for that, the one who is working with the patient, that person also has to care himself.
Yes, self-care is a huge issue. Yes, yeah. They talk a lot about self-care. It seems to me the most important aspect, or one of the most important aspects of self-care, is that it's not self-care. It's the fact that the person, the chaplain or the person who's offering this care, is part of a team, or we might call a sangha, of other caregivers who they can really lean on, seek advice. They need their own chaplain.
That's right.
Because they get secondary trauma from dealing with so much trauma.
Yeah,
so
continuously, if you are working with that, there should be a...
right. Yes. So like in a hospital in the United States, a chaplaincy, there'll be a team. There'll be usually more than one. And because they'll have maybe 3 or 4 chaplains from different religions. And hopefully they work together. And there'll be a chaplain supervisor, sort of ahead of the team. In our suicide prevention work in Japan, we first started doing this research 2006. Most of the monks and nuns we met were working individually. This work had just begun. But then we were able to help develop a network. And now these monks are all tied into regional networks and national networks. And they may often meet as teams. So they definitely have people to, lean on, support, connect to. Because yes, it's very difficult work. I have a good friend. He's a Zen chaplain, I guess. Does a lot of suicide prevention. He's quite an interesting character. There's been a documentary made of him. I had hoped to bring him here this time. He got a little bit sick, but. He sort of overworked himself and had a heart procedure because of stress and it was a little too much to handle. So he's had to learn his limits.
Yes.
Because again, you can't, as the saying goes, you cannot save anyone. You cannot save anyone.
So in this world, how much the certain rituals comes into... is there, you use rituals?
Yes, rituals are very important. I think we have one of our excellent chaplains in Japan. His name is Reverend Yozo Taniyama. He founded Interfaith Chaplaincy Training Program after the tsunami. And he talked about spiritual care and religious care. And spiritual care is the kind of non-religious, just like I said, being present, being open, having people find their own solutions. You can do this for anyone. Sometimes there are also people who want something religious. They are already devout, or they're looking for something, and they may request something. And in that case, the chaplain will offer something religious, and it might be a ritual. It's interesting, again, if you're practicing interfaith chaplaincy, if you'll be a chaplain from one particular order, you may need to do some basic study and even learn some rituals of other religions. Because if you come into an emergency situation, if you enter into the emergency ward and you're the only chaplain there, and you're a Buddhist chaplain, but the person who's dying is Christian, and they want last rites, you need to be able to provide something for them. So there are all sorts of different kinds of rituals. There may be very particularly religious ones, like this is a specific Buddhist one, a specific, Christian one. There also may be creative rituals that are done for people who aren't particularly religious in one way or another. And that may be very helpful and prominent in more secular societies where you can't rely on people. You come in, people are like, I have no religion, but they need something. A ritual can be some sort of symbolic action that's less verbal, that helps the person connect with their heart and maybe their gut in a meaningful way. In Japanese Buddhism, the core of Japanese Buddhism is ancestor worship through funerals, and then after someone has died, memorial services many years afterwards. So in a bad way, sometimes they call it funeral Buddhism. They the monks don't do anything; they just do funerals.
Okay.
And they collect their money. But some of these monks nowadays have been using creative funeral ritual to deal with grief. Right. And are trying to sort of reform, quote unquote, funeral Buddhism by using it in a more dynamic way. So one of the ways is with suicide. Contrary to opinion outside of Japan, suicide is not okay in Japan. Many people think, the Japanese do suicide and it's okay, it's part of their culture. It's not. It's a social taboo. It's a taint on the family. When people commit suicide in Japan, the families hide it. They develop secondary traumas. They may also commit suicide because of the fact that they're not able to openly express it. And so many times after someone has had suicide, you go to the funeral and it's tiny. Almost no one comes because they don't want to invite anyone because it's an embarrassment. So this kind of funeral is more damaging. It doesn't begin a healing process. It's more harmful. So this group of priests, they'll get together once a year on December 1st, and they'll rent out one of the most beautiful temples in Tokyo, a place that only the very rich and powerful can have a funeral. And they'll reserve the temple for a day, and they will put an advertisement in the newspaper to invite people who have lost people to suicide to register, and they'll have to have a interview first to prove, because this is a closed ceremony, very sensitive. And then they will do a very gorgeous funeral ceremony in this gorgeous temple with 70 monks dressed in their finest robes to honor this person. And this is part of the destigmatization of suicide, which is part of the destigmatization of mental health that these monks are working on. A lot of people who suffer from mental health issues feel stigmatized. Suicide is even more stigmatized. These monks have done a lot of research and question whether suicide is categorically bad karma that will lead you to hell. And they want to be a lot more sensitive to the various ways that people end up often rather accidentally taking their lives. And so, through these funerals, they help to heal these multiple layers of trauma and damage that have happened. Some of these traumas have also been perpetuated by temples and monks. The person dies, the person kills themselves, the family feels terrible, they go to the temple, they end up telling the monk.
Yes.
The monk goes, well, I'm sorry, we cannot bury your son in the temple graveyard because he committed suicide. And that's a taint. It's a stigma, so we can't have that kind of person. So you have to find another graveyard. And also, if you want us to do the funeral, twice the price. So it's just like, oh my God, you just made it much worse. So there have been very wonderful work by these priests in Japan to try to destigmatize this. But yes, ritual ritual, specific ritual, adapted ritual, creative ritual. Sometimes a chaplain will facilitate a person to create their own ritual.
Right. Well, now I have been working with those who are dying. When monks are invited to, sometimes chanting Piret and all that, the person who is, they sometimes get shocked, kind of, because if the monk comes, that means a message that you are going to die.
The Grim Reaper.
Yes, yes. How to deal with that? I mean,
it's a even worse in Japan, because the monks are so tied to funerals. And then because of secularization in modern Japan, they also become so disconnected with pre-death rituals and support. Any roles that monks had in the dying process ended in the, traditional non-urban pre-modern era. So yes, there have been many cases the monk tries to come in and say, hello, I'm here. And the patient goes, what are you doing here? I've paid for my funeral. Get out. How dare you come in here? I'm not dead yet. So, you have to, takes a lot of what we call in Buddhism, upaya, a lot of skillful means.
Right.
You have to, and this is also educating the public.
Right. That's right.
Educating the public on the role of chaplains. But you also need to have chaplains, because sometimes you will invite a monk and all they don't really know.
That's right.
They're just coming and all they're like, okay, we're just going to chant.
Yes. Not to talk with
and
the
if,
person.
if that's all they can do, then maybe it's not helpful.
That's true.
So
this is a different role, talking with the patient and make that person easy, and not just to go for chanting and prepare, but to continuous discussion with them, then that kind of dialogue. And it is not particularly coming just to prepare that person to face the death. It is
So in a hospital that has a regular chaplain or chaplains, they are there every day. So when a person comes into the hospital at the beginning, a chaplain will come by and just knock on the door. Hi, I'm Reverend. I'm the hospital chaplain. I'm here.
Okay.
Just thought I'd introduce myself. If you want to talk anytime, I'm here. But nice to meet you. And they maybe go, yeah, fine, never mind. Or but maybe 3 days later, they're like, oh, hi. Yeah, maybe I kind of want to talk about something. So because the chaplains are in the hospital every day, so there's a very important point in professional chaplaincy, and there can sometimes be a conflict of interests. You can get a chaplain to come in from outside. If that chaplain is being paid by a temple or a church, they may have an agenda to propagate the teachings of that temple or church.
All right.
Now, most professional chaplains are going to be paid by the medical institution. So they're working as part of a medical team. So we talk about team care. They work together with the doctors, nurses, psychiatrists, social workers, chaplain. It's a team. And they have a role, and they're being paid by the hospital. So their agenda is to work with the other medical caregivers to support the patient. So it's very important. That's why professional chaplaincy is important.
Yes, that's right. That's right. I'm sure the area that you are working is very important to this country. As you mentioned, I think during last 30 to 40 years time, we have faced lots of tsunami, as you mentioned.
War trauma.
Yes. And then war. Yes, war. And in not only the war in north and east part, but at the southern part also we had some insurgents time.
Yes.
And so many people died, disappeared, and yes. And then this economic, I'm sure kind of psychological support and spiritual support is very much needed. And then those who are aging and dying, huge area, huge avenue is there for helping people. I think this, what you discuss, is very important. There, what I understand, here we don't have that kind of institution or religious, that paying for the work. So the Sri Lankan situation is different. But what I understand, most of the time, those who are very ill or very old, and if the children invite a monk to come and then it becomes kind of message that you are going to die soon.
Yes.
And the kind of fear comes. So I think this is an area that we have to work to change that. It is not that monk come there to prepare you to just to, now your dates are counted. No, it is not that, So that is, I think that is an area that it should be developed here.
Right. Well, it's also an adaptation to urban life.
Yeah.
Because in village life, if the monk comes to visit a dying person, everyone knows the village monk.
Yes.
So it's nothing big. It's like, oh, Bante's here, wonderful.
Yeah.
I've missed seeing him because I've been in the hospital. Because usually grandma goes to the temple every day, right?
Yes. Yeah.
But in urban environment, it's like, who is this monk? I don't know this monk. We're not connected.
Sure this is very much particular to the city, urban areas.
Yeah.
That's right.
Yeah. Same in Japan.
Yes. What more you can share with us, particularly suicide prevention part?
Well, I think one of the interesting. I'll just talk a little bit about the development of how these priests became popular in Japan, because in the post-war period, like I said, Japanese became very anti-religious after the war, because all their religious groups were very active in supporting the war, and Japanese came out of the war and were like, we cannot trust religion. And Buddhist monks lost all their social roles, and all they became were ritualists. And, the religious institutions move with the tide. And as Japan became rich, the temples became rich. And suddenly there was a monk driving a Mercedes and you paid for his Mercedes because you paid for the funeral, and people not happy at all. So people did not go to monks to seek personal advice. But when the Japanese economy started to really collapse in the late 90s, and the suicide rates started to skyrocket, and it wasn't just suicide, all different kinds of forms of psychological suffering, the social fabric started to fall apart, and people felt there wasn't any place to go. If they had a psychological issue, you go to a doctor, but a doctor writes you a prescription and you take a pill. In the Japanese office and life work, it's just gambare, work harder. So you hide that you're not doing well. So that lead to something called karoshi. Karoshi is death from overwork.
Okay.
You keep coming to work, even though you're on the edge of dying. You just keep going until you die one day. So what happened is that their people just became desperate, and they were looking for someone to talk to. And there were just 4 or 5 priests we found who were just doing they make a little internet site. Or I know a priest who, you have the temple, but then there's the temple gate. So the temple's inside, but outside the temple gate, there's a message board. So people walk by the temple, they see the message board. And the message said, your problems may seem trivial to others, but there is someone here who will listen to them. And people just started walking in off the street. They didn't even belong to the temple. They just walked in off the street because I have no one to talk to. So this is how they started to become sort of popular. And then people found you could go talk to this priest 3-4 hours. Usually with a therapist, it's 45 minutes.
Yes.
And then you pay your money.
Yeah. Yeah.
And boy, at the 44-minute mark, we were really starting to touch something.
Yes.
But time ran out, so I'll talk to you next week.
Yes. Yeah.
But with the monk, you could just keep going and going.
That's right.
And then he didn't charge you any money. So this is how they became popular and important in Japan. And yes, I think it wasn't so much they were reaching out and finding people, but people were finding them. And then, again, it's difficult to continue to do just all this individual work. There are too many people. And I think one of the great illusions of our modern society is that we can become psychologically well by ourselves. So the self-help book, and I'm doing yoga, and I'm vegan, and I'm practicing mindfulness, and I am still not happy. Because Buddhism says as soon as you're saying I am, there's going to be a lot of dukkha. And that actual psychological well-being, mental well-being in general, comes from being part of a collective, connected humanity, which also includes our environment. So that healing comes through being with other people. So some of these priests are finding that they'd like to do group activities. So many of them are doing creative group activities. And I know this one priest, he's quite interesting. He would have, because some people don't really want to come to the temple. They feel a little uncomfortable in the temple. So he created an event in the park, famous park, yoga and Zen in the park. Oh, sounds nice. So people come. He found a yoga teacher. So he and the yoga teacher did Zen and yoga in the park. Great. Sunday afternoon, a lot of people came. It was fun. So I talked to him afterwards and I said, oh, everyone here is suicidal? And he's like, I don't know. And I was like, you don't know, but I thought this is for suicide prevention. And he's like, one of the mistakes we make is this either or. Someone is suicidal and everyone else is kind of okay. People are mentally ill and the rest of us are normal. Yeah. But we're all on this spectrum.
Right. Yes.
All on this spectrum. And there are times where a bunch of things happen really bad at one time, and we can go from well to really psychologically unwell quite quickly. Yeah. And then we can also come back. So some of these priests have been finding that through these kinds of more open group activities, that they're catching a wider swath of people, and that it's kind of almost more effective. Because really, a lot of the heart, at least in Japan, of the lack of mental health is the disconnection, this deep disconnection between people, and the alienation and disconnection of living these fast urban lives. And even young people talk about it. You have your smartphone, and you have Instagram and TikTok, and you have many friends. But then all these people say, I have no one to talk to. It's like, but you have all these friends. Because they lack intimate connection. So it's sort of creating new community and new community places for people to gather and share a kind of authentic intimacy. And I think this is how their work has grown from sort of individual counseling to now something that's almost more rebuilding the fabric of society.
So you have been in Sri Lanka several times, and you have some idea about the if you have something particular to share with Sri Lankan community.
Well, it's certainly I first came to Sri Lanka in 1999. I was in my 20s, and I didn't have anyone to pick me up at the airport. I don't think you could pick anyone up at the airport in 1999 because of the war. And I'm in a little tuk-tuk at 2 a.m. trying to find where I was staying, and it was kind of scary. So it's a huge change since then, and I can feel there's so much more ease in Sri Lanka now since the war has ended. Obviously, there's a lot of leftover traumas, but I think despite the economic problems that you've had recently, and there's always a sense of something is wrong, I think I feel a very good energy in Sri Lanka. I've been here for 3 weeks this time, 3 weeks consecutively. I feel people are a lot more at ease than they used to be. But they're obviously suffering still. There's always dukkha.
Yes.
But yes, I mean, I've had some good workshops and good meetings here, and our plan with our new institute is to help support not just Buddhist monks or nuns, but also Buddhist lay people to develop greater skills in this area, chaplaincy, counseling. It's kind of updating the Dhamma. The Dhamma is always fresh underneath. It's always, I wouldn't say pure. It's always fresh. It's always relevant. But it gets sort of coated over with some ancient practices. And certainly young people are becoming less and less interested with that ancient form. But there's a lot of potential to still revive. And one of the ways is through chaplaincy, and also for me, it's engaged Buddhism. Chaplaincy is really also engaged Buddhism. It's the creative application of Buddhism to social conditions. If we look at Buddhism, it's the Four Noble Truths. And the first noble truth is dukkha. So what is the dukkha? If the dukkha is suicide and social media addiction among young people, how does Buddhism meet that? Buddhism has to go to that place. Buddhism can't stand in the temple or on the mountaintop and go, young people should stop being on their phone and come to the temple and do the chanting. You'll just get laughed out of town. But if you go to their place and you listen to them, a skillful Buddhist will find a way to connect and to communicate. So, there's an idea about that. I think one good story I have is I have a friend in Texas. She's a Buddhist therapist. Her name's Jinji. And she works with young adults and teenagers. And, nowadays, young people have so many struggles, and they get stuck in so many difficult things, and their sense of self is so poor, and they feel like there's just no hope, and there's nothing that can be done. And she told the story of a young man who had a very powerful, influential father. Unfortunately, his mother died very young, when he was a very young boy. And a lot of expectations on this boy from the father. And he did his best. He was sort of a very good boy for a while. But it was too much, the pressure. So he ran away from home. And he ended up, he joined a religious cult, which wasn't very good. And then he developed an eating disorder, almost starved to death, became very thin, started engaging in self-harm, cutting himself, doing such terrible things, and was literally homeless and found dead, almost dead on the side of a river.
Okay.
Does this story sound familiar? Shakyamuni Buddha. That's the story of Shakyamuni Buddha.
Yeah.
Powerful father, mother died in childbirth, couldn't handle it, ran away from home, joined these crazy, Shramana cults in the forest, and he's starving himself to death, and he was almost dead by the side of the river. But a little bit of rice gruel, a connection with a young woman who helped him, and the young boy who helped him, and then he found his way to enlightenment. So she uses this story, as a story of hope and potential. You know, the Buddha came from that. The Buddha came from being dead by the side of a river. But it was her creative way of updating that story.
Yes.
That story that seems like an ancient story, but it's like, no, it sounds kind of familiar. A young person runs away from home, joins a religious cult, develops an eating disorder, engages in self-harm, and becomes homeless. That happens all the time in America. So if we get the heart of Dhamma, we can be quite creative with it. And our age requires a lot of creativity.
That's right.
But we can learn from other creative people.
That's right.
Creativeness is not some magic skill that special people have and the rest of us don't. We can all unlock that creativity.
Thank you, Jonathan.
Thank you, Venerable.
And this discussion is very useful and relevant. We like to know more about, and those who are interested can visit the website and get more information.
Yes. INEB Counselling.net is our new site for the Institute for Buddhist Counseling and Chaplaincy. My own site in Japan Network of Engaged Buddhists, has a lot on suicide prevention, jneb.net. Those are two resources you can go to. If you're watching this program and you want to get in contact with me, contact Venerable Dhammananda.
Yes.
And we hope to, not just me, we have many wonderful teachers and guides and supporters who I hope to have come to Sri Lanka. And also you might want to come visit us somewhere and study and learn as well.
That's true.
We have a great network all over Asia.
Thank you very much.
Thank you very much. Thank you so much for having me.
Thank you. And on behalf of the Walpole Rahul Institute and our viewers, thank you for accepting our invitation and coming for this program. Thank you. Thank you.